Good morning, everyone. I'm so glad I'm here today. I am Professor Giselle Guginski, and I will talk with you about cosmetology applied to the physical therapy care in the post-operative of plastic surgeries. First of all, I would like to greatly thank the organization of this discipline, especially Professor Ana Beatriz Pegorari, Universidade Federal de Mato Grosso do Sul, and University of Arizona. It's a great pleasure, a great honor, and a big responsibility to be here today representing the Brazilian dermatofunctional physiotherapy. I will start today telling a little bit about my history and experience. I am physiotherapist since 2004, when I graduated in the Universidade Estadual de Santa Catarina, localized in Florianópolis, a stunning island in the south of Brazil. Just after my graduation, I started my master degree at Universidade Federal de Santa Catarina. That was followed my PhD studies in the same university. During this time, I also performed 2 post-graduations, one in acupuncture, other in dermatofunctional physiotherapy. Today, I work mainly with post-operative plastic surgery, aesthetic, and cosmetology. And I have a special interest in herbal medicine, phytomedicine, phytotherapy. Behind this, I am professor in several post-graduation courses of dermatofunctional physiotherapy, and I coordinate one of them. It's not in my CV, but I am married and I have 2 kids, one beautiful princess, aged 5, and my little prince that have 1 year old. I believe that my colleagues who were here before me have already talked a little bit about physiotherapy in Brazil, but I decided to bring some data to show how our profession is and particularly our specialty is young. We are recognized as first contact professionals in Brazil since 1969. And the Brazilian Dermatofunctional Physiotherapy Association was founded in 2005. And we were recognized as physiotherapy specialty only in 2009, just 12 years ago. We are so young here in Brazil, so young like a profession, so young like a specialty. But our focus today are in cosmetology. And because of this, I decided to concentrate what is cosmetology and notice is the science. Again, is the science that studies cosmetics in order to know their applications, effects, and properties of raw materials and their actives. In addition, is also related to the development and analysis of products, not limited to development of new products, but also to the improvement of existing formulas. So it's a science. In this way, empirical information, and that thing that was wonderful to the friend, to your friend's cousin, should be left out. Our choices must be based on scientific evidence. Okay, Giselle, We did our homework, we entered PubMed, and we searched all the raw materials, but the physiotherapist can prescribe? Yes, at least here in Brazil, it's possible. Since 2017, we are authorized to prescribe some substances, named phytomedicines, orthomolecular, homeopathic, flower remedies, and over-the-counter medicines. Among these substances, I would like to give a special attention to phytomedicines for several reasons. The main one is that I live in a country with a very large biodiversity, and we have several study groups in Brazil dedicated to the study of natural products. However, at least here in Brazil, there is still a lot of confusion about what is herbal medicine, what is herbal medicine. Let's see the definition. Use of plant-derived medications in the treatment and prevention of disease. Phytotherapy is a science-based medical practice, and thus is distinguished from other for more traditional approaches, such medical herbalism, while it relies on an empirical appreciation of herbal and medicinal herbs, and which is often linked to traditional knowledge. So that grandma's specialty cannot be considered a phytomedicine or a phytocosmetics. So again, it's a science. A science, it's only based on evidences, not in traditional knowledge or empirical knowledge. Okay? Okay, Giselle, you talked a lot about phytocosmetics, but which type of cosmetics should I recommend? Those sold in pharmacies, drugstores, or cosmetic stores, or can I prescribe magistral formulations? Each one has its pros and cons. For example, standard cosmetics are safer, but usually have lower levels of active ingredients, while magistral formulations give you the opportunity to have a customized product for your customer. However, the final result depends on the quality of materials and the laboratory used, as well as demanding greater knowledge, a greater knowledge from the prescriber. Another important point that we must emphasize is that, unlike a few years ago, the use of cosmetics is no longer only topical. Today, we have many cosmeceuticals taken orally. And here in Brazil, the physiotherapist can prescribe orally too. We must also be careful with the type of vehicle that we will prescribe, always remembering that hydrophilic vehicles dissolve hydrophilic molecules. Well, while lipophilic vehicles dissolve lipophilic molecules, okay? In addition, it's important to check if there is any interaction between the molecules of the formula, okay? In the same formula, you cannot put an acid and a base, okay? For example. Having said that, We will now enter a second part of this class, where we will talk about some symptoms and complications that can happen in the postoperative period. Among these, the first one that we will address is pain. That is a very common complaint in our patients. But we know that pain depends not only on the applied stimulus or the stimuli nociceptor, but also on the emotional color that each person gives to this situation, okay? For this reason, everything that modulates our emotions potentially also modulates our pain. A study published in 2011 demonstrated that lavender essential oil was effective in controlling postoperative pain in women who have undergone C-sections. If we were to prescribe cosmetic for postoperative use for our patients, this would be an interesting fragrance, okay? If you can put the lavender oil in the formula, it's very interesting, okay? Another frequent symptom is the edema, that is swelling caused by the accumulation of fluid in a part of the body, and it's often accompanied by inflammation. This is important. Besides lymphatic drainage, is there anything else that can we use to control it? What do you think? Yes. Essentially, we could use two other weapons. One topically, another one orally, okay? By oral route, we can use the lymphatic drainage pills that here in Brazil have the commercial name of cactinea. There is anything else but Opuntia ficus indica extract, that is this cacti over here. And this substance have direct effect without mineral loss and helps the osmotic control of the body. Besides this, it's a extract rich in antioxidant compounds. Excuse me. So it's a pill that you prescribe to your patient and helping the lymphatic drainage, okay? The other resource that we can use is a kind of ginger extract. This is used by topical root. The extract of the roots of Zingiber Bat-Smith was able to prevent the edema formation, especially on the legs, by protecting the microvascular environment, inhibiting proteases and reducing the reactive oxygen species. Here in Brazil, the commercial name is Legans. The only particularity is the color of the cream is a light brown. So to put on the legs, it's okay, but other parts of the body is a little bit complicated, okay? Have a color, this cream have a brown color, okay? Like a makeup or something like this. A big part of our patients will develop echimosis after the surgical procedure too. Just to remember, let's see the definition of echimosis. It describes a flat blue or purple patch measuring 1 centimeter or more in diameter. Occurs when blood leaks from a broken capillary into surrounding tissue under the skin. As the tissue heals, the area of echimosis may change from purple or blackish blue to yellow or green. Echimosis will typically take between 1 to 3 weeks to resolve. So 1 to 3 weeks is a very long time for white skins like mine, maybe 4 weeks. So can we use something to shorten this recovery time? Maybe. Again, the answer is yes. We have this beautiful yellow little flower called Arnica montana, whose main active ingredient is alanine, that is able to modulate and inhibit many pro-inflammatory pathways, named NF-kappa B, pro-inflammatory cytokines, and the nitric oxide pathway. The nitric oxide pathway is very important to capillaries, okay? So it's one of the main actions of Arnica montana to helping us on the bruises is through the nitric oxide pathway. Some prescribers like to use Arnica by oral route in the form of tincture or homeopathic medicine. However, the most part of the studies involving this extract is conducted by using topical route, okay? Now we are talk about a ghost that some years ago haunted every patient that will submit yourself to a plastic surgery, and that is fibrosis. It was seen as something without treatment. Once installed in the patient would have to, the patient would have had to live with this forever. Let's see again the fibrosis definition. It is the development of fibrous connective tissue as a reparative response to injury or damage. Fibrosis may refer to the connective tissue deposition that occurs as part of normal healing, or to the excess tissue deposition that occurs as a pathological process. To prevent and treat fibrosis, we must know that the onset and maintenance are linked with uncontrolled inflammatory response and the differentiation of fibroblasts into myofibroblasts, okay? So 2 things very important in this slide. First one, uncontrolled inflammatory response, okay, is linked to the onset and maintenance of fibrosis. The second one is the differentiation of fibroblasts into myofibroblasts, okay? So the first resource to help us with fibrosis is curcumin, a molecule extracted from turmeric or curcuma longa, to be more exact, from the root of this plant, this beautiful plant, this pink flower. Between many actions, curcumin is able to block TGF-beta 1, that is this one on your computer or your screen. And for this reason, blockade the differentiation of fibroblasts into myofibroblasts. Myofibroblasts have the ability, the capacity of hypertrophy, migration, and production of extramolecular matrix. Okay, so it's a huge addition in our treatment. Okay, it's a very important molecule, curcumin, to help us to treat and prevent fibrosis. Another pathway that could aggravate our patient's fibrosis condition is collagen glycation. This happens especially when the patient ingests large amounts of foods with high glycemic index. This sugar can bind to collagen, leading to the formation of advanced glycation end products, like we see here in the slide. So we have the collagen and the reducing sugar, resulting in a broken collagen, okay? A damaged collagen, not collagen. These molecules will affect multiple targets for us. The main ones are immune cells, enhancing proliferation and inflammation. Do you remember that uncontrolled inflammation is one of the causes of fibrosis? Fibroblasts, enhancing protein misfolding and inhibiting contractility. Okay, so this protein misfolding will help to generate fibrosis. And in the ECM extramolecular matrix proteins, causing cross-linking and many molecules disorganized, shorter and thinner, okay? To prevent this situation, the ideal would be to avoid excessive consumption of foods with high glycemic indexes, okay? But as we cannot always control our patients' intake, we have some resources that can help us with collagen glycation. This is one that is carnosine, or the carboxycarnosine. It's a kind of peptide, okay, a synthetic peptide, okay. Could be used by topical use at the concentration of 1%, or orally between 300 to 600 grams a day. Because it's a synthetic peptide, it's not inactivated via enzymatic reactions, and it has prolonged bioactivity on the skin, okay? Another kind of intercurrence is the post-inflammatory hyperpigmentation. That is a temporary pigmentation that follows injury or inflammatory disorder in the skin. So surgery generates a big inflammatory response on the skin, okay? It's mostly observed in darker skin types, you once installed, there are a few features that can be used to lightening the region, okay? So after the surgery, we have a massive inflammatory response. If you not control this massive response, you can generate post-inflammatory hyperpigmentation, okay? If your patient came with this kind of bruise, you can treat with some cosmetics. One of them is azelloglycine. That is a topical cosmetic. The concentration for use is between 3 to 10%, and exert our effect by blocking tyrosinase. Tyrosinase is an enzyme that will form melanin. So when we block tyrosinase, we prevent the formation of melanin and the formation of the staining, the bruise, okay? Giselle, why azelloglycine and no azelaic acid? You can use azelaic acid too, but azelloglycine have a greater stability and safety when compared with azelaic acid, okay? The other resource is Leoropeia fruit extract. Yes, olive extract. Giselle, can I use olive oil? No, you cannot use olive oil. Is a extract that is standardized in hydroxytyrosol 3%, okay? Hydroxytyrosol, I'm sorry, hydroxytyrosol 3%, okay? Here in Brazil, the commercial name of this extract is Oliola. Have a great commercial appeal because the slogan is capsule peeling. So it's like you take the pills and you do a peeling. You did you have a new face, a new skin. So the dose is 300 milligrams a day, taken orally. And this extract delays oxidative reactions involved in melanogenesis. So have beautiful effects. So it's a great weapon to use against post-inflammatory hyperpigmentation, okay? And other stains too. But here it's a very good weapon to us, okay? And talking about staining, another kind of postoperative staining is related to hemosiderin, because there is a process of degradation after the formation of echimosis in the postoperative period. During this process, part of the pigment can be deposited in the dermis. This process can be accelerated or facilitated by sunlight. So that recommendation that our patient cannot expose the skin to the sunlight at least 6 months after the surgery, okay? To difficult this process. This condition could be treated with thioglycolic acids in a 5% concentration by topical use, okay? Could be every day or one day I use and another no, okay? I don't. One day I use and another one I don't use, okay? Now we can talk a little bit about keloids and I'm sorry, hypertrophic scars, okay? And we can improve the appearance of this kind of scars with cosmetic. Yes, we have a lot of cosmetical interventions. But first, let's see the differences between the hypertrophic scars and keloids, okay? The hypertrophic scar, it can regress with time, appears as a red raised scar tissue, promotes contractures. It does not extend beyond the boundary of original wound. This is a big point, okay? Does not extend beyond the boundary of original wound. Here I can differentiate one hypertrophic scar from a keloid scar, okay? A keloid scar do not regress with time, appears like shiny rounded protuberances. The color ranges between pink and purple, do not promote contractures, but extends beyond the boundary of original wound. That is very important. But if you notice, I didn't talk about a characteristic from both scars. Both have an erased TGF beta, okay? So it's an inflammatory tissue. It's a very inflammatory tissue. So I have to control this inflammation again, okay? Like I have to control the inflammation in fibrosis, like I have to control the inflammation in post-inflammatory hyperpigmentation, okay? Again, here, I have to control the inflammation. One of the things that I can use in the treatment and prevention of this kind of scar is centella asiatica. I found a study that used 225 milligrams a day since the second week after the surgery. And then when they evaluated by ultrasound, they found more regular and homogeneous tissue in those people who have used centella asiatica in post-operatory period, okay? Something that is very, very important, that is contraindicated in people with ulcer and gastritis because of the high tannin levels, okay, can worsen the symptoms of these conditions, okay? Another possibility is the use of pine bark extract or Pinus pinaster extract. Here in Brazil, the commercial name is pycnogenol. I saw a lot of studies with the name pycnogenol, so I think that in other places is the same commercial name, okay? this extract could prevent the scars, that hypertrophic scar, or the keloid, because the extract inhibits TGF-beta. Could be used by topical route between 3 to 5% concentration, or orally 120 milligrams per day. Okay. So as you can see, we have numerous cosmetic resources that can be used in this post-surgical rehabilitation phase. However, more studies are still needed, especially aimed at our specific population, and perhaps multicentric and randomized studies. Okay, we need to advance more and more in this area. We are just little kids in the studies, so we have to grow up and have more fundamentals for our practice. Okay, more evidence for our practice. Here is some of the evidences that I used for this lecture. Okay, and some of the references. Okay. I would like to thank each one of you for the attention, the interest, and the patience, because I know I am the last lecturer of the discipline. I would like to thank again Professor Ana Beatriz, UFMS, and University of Arizona again. Besides that, I would like to make myself available. If you have any questions, I will leave my email here, WhatsApp. Don't forget, I am in Brazil, +55 and then the number. Instagram, I have 2 Instagrams. It will be a great pleasure to talk with all of you. I hope you have an excellent performance in the exercises that I developed. So thanks again. Bye-bye.